Here at LSK 121, we often share how we fabricate our Syton 5000 zirconia restorations. However, we rarely get to see what happens after the arch is delivered to the doctor's office. So for this video, we'll be taking a look at a dentist inserting a Syton 5000 into the patient's mouth. Stay tuned. Here's the finished Zirconia Arch, a 4-implant upper anterior restoration that extends to the premolars, plus a temporary crown. Once it's approved by Luke, the arch is shipped off to the doctor's office. After receiving the arch, the doctor gets it all ready to go before screwing it into the patient's mouth. First, they'll do a test fit to make sure everything fits correctly. If everything fits perfectly, the doctor will proceed to screw in the arch. Once screwed in, the patient will see how it looks and feels in their mouth. If everything fits and looks correct, then we've done our job. This restoration was made using implant screws provided by Rosen Screw. The case was from Dr. Vargas in New York. Thank you for watching. If you're interested in seeing more dental restorations like this, follow Luke on social media at Kahng. For more dental tech content, become a YouTube member or join our Patreon at patreon.com/LukeKahng.